Good afternoon. I'm Jeff Birdwell, Director of the Huntsville-Madison County Emergency Management Agency. It is Wednesday, September 29th. On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville Area Government, Healthcare, and Emergency Response Agencies, we bring you this briefing on our community's response to COVID-19. Our speakers today will be Mr. Tracy Doty, Chief Operating Officer, Huntsville Hospital, and Kathy Miller, Community Impact Director from the United Way of Madison County. At this point, I'll go ahead and give the current COVID numbers. In the state of Alabama, there's 794,773 cases of COVID-19. In Madison County, 50,310 cases, having resulted in 637 deaths in Madison County. Current positivity rate is 13.5%. At this point, we'll go to our first speaker, Mr. Tracy Doty from Huntsville Hospital.
Thank you, Mr. Birdwell. It's a pleasure to be here. I want to start out by thanking our... It's a pleasure to be here. I'm going to start out by thanking Mr. Birdwell for the opportunity to be here, and to thank our healthcare workers in North Alabama for taking care of patients. We all know that you switched from night shift to day shift, worked weekends, missed your kids' ball games, all to take care of our community, and want to say thank you. Your efforts don't go unnoticed. If you look at our numbers at Huntsville Hospital, this includes Huntsville Hospital Main, Women's and Children's, and our Madison location. We have 144 positive inpatients, 40 of those in the ICU, and 39 of those patients on the ventilator. Our age distribution, the youngest is 27 days old, and the oldest is 97 years old. Average age is 62. The male to female breakdown, 58% of the patients that are hospitalized with COVID are male, 58% are male, and 42% are female. The numbers remain the same, are pretty close to it. 90% of the patients in the hospital are unvaccinated. I'll repeat again, 90% of the patients in the hospital are unvaccinated. We've had 2 deaths in the last 24 hours. Pretty close to the state average. Our positivity rate is about 15.5%. Good news is it was 17% last week and 22% the week before that, which are all good indicators that we're going in the right direction. And at our fever and flu clinic and in our labs, our testing demand is down about 50% over the last 2 weeks, which is another good sign. Looking at Crestwood, they have 28 inpatients right now. 6 are in the ICU, and all of those on the ventilator. And their numbers are like ours. About 90% of their patients in the hospital are unvaccinated. We get a lot of questions about ICU beds. ICU beds are a real concern of ours. They're full across the state as well. If you look at our state, there's 1,535, that's our capacity for ICU beds, and there are 19 available as of yesterday. That's only 1% available. Downtown at our hospital now, we're negative 7 beds. We're holding 7 ICU patients in our ER, which means all of our ICU beds are full right now. So even though the numbers are looking better, we're not out of the woods yet, so everybody should remain vigilant and safe. We had 20 deaths in the last week or so in Madison County. That trend is helping the numbers go down. Not a good thing. That's a part of it. Deaths of the unvaccinated and vaccinated, a few vaccinated people in that number. The CDC and 50 other professional organizations recommend the vaccine. So we want to encourage people to get the vaccine. There are multiple places in Madison and North Alabama you can get the vaccine. It's pretty easy. Most places you can walk in or schedule online. There's ways to get there. Multiple ways to get there, and we'll talk about some of that later in the briefing. If you look at our vaccinated rate in Madison County, 64% of our citizens have 1 dose, and 54% are fully vaccinated as of yesterday. We need that number to be higher. We need to encourage people, go out and talk to our neighbors and our friends, look at reputable sources to get your information. In surrounding counties, about 30 or 40% are fully vaccinated, the counties that touch Madison County. Monoclonal antibody therapy. We heard last week that it's on allocation. That's still the case. working closely with the state to make sure we have enough, and so far no issues. I am glad to say the demand for that is down as well. We're not getting as many calls, which means that less people are getting sick. And as a reminder, the monoclonal therapy is not a substitution for the vaccine. Still want to get vaccinated, but if you do get sick, the monoclonal therapy helps you reduce the chance of you getting really sick and being hospitalized. So make sure you take your vaccine. Reminder, masks do work. Wear your mask when you can. Do events outside if possible, but when you're inside or around people you know aren't vaccinated or they are vaccinated, wear your mask. It doesn't hurt you to wear a mask. We get questions about our rumors that masks hurt people or masks do this, masks do that. And I remind people, doctors, surgeons, nurses, dentists have been wearing masks for 50, 60 years, 12 hours a day, and they're still fine, walking around doing well. We all know the third dose of the vaccine has been approved, and as well as boosters. The difference is the third dose is for immunocompromised people. They might need a third dose to make sure they have enough antibodies or their body responded well to it. And then the boosters are for other people, and it's for Pfizer only for the booster right now. And you can go to your original site of the Pfizer where you got the vaccine, John Hunt Park, or multiple other locations. And these are for people who are 65 and older and residents of long-term healthcare settings, people 18 to 64 with underlying medical conditions, or people that they have increased exposure to other people. We get questions for vaccines for children. That's coming. We don't know when. Hopefully early winter. We will do those at John Hunt Park. We're prepared and ready to do those once the deadline is given or the date's given from the FDA and CDC. We don't know when, but it's coming soon. And I'd like to close by thanking the Chamber of Commerce and others for giving donuts and cookies, and churches and others for bringing by cards to our staff. It may seem like it's not much, but the staff really appreciates it. And last but not least, get your vaccine and wear your mask. Thank you.
Thank you, Tracy. Now we'll go to Ms. Kathy Miller from the United Way of Madison County.
Thank you. I'm going to take this mask off temporarily here. Do a little branding. So, certainly, United Way staff and board are concerned for our community, and we're so grateful to be here and join these leaders to talk a little bit about the roles that our nonprofit partners and United Way are playing in the community to help us with this unusual and real concern with our pandemic. And so the first thing I want to talk about is something that I hope many of you already know about, is that thanks to a wonderful support from Blue Cross Blue Shield of Alabama, United Way is able to provide free, safe, secure rides in a rideshare environment with Lyft to and from any vaccine site or appointment here in Madison County. Now, as United Way of Madison County, we're proud to say we're the only United Way in the state of Alabama doing the Ride United program for both medical, including the vaccines, as well as employment-based rides. But the important thing for us to remember here and our citizens to remember is that if you live in Huntsville, including the slice of Limestone, East Limestone, that is annexed into Huntsville, or anywhere in Madison County, you can call our hotline, 211, which is always a place to call when you need help and don't know where to turn, but you can call there and they will schedule that ride with Lyft for you. It's always great if you have an appointment to call a few days early to make sure, because those drivers are busy taking people to places when they have no other option for transportation. But we are very excited to say we've already given 128 rides for people to get the vaccine since March. And so we'll continue to do that as long as that's needed. And it, again, is as simple as dialing 211. We have, if any of you are on social media, United Way is UW Madison County, and we have pinned a flyer about this on our page. So we encourage the community, if you are active on social media, share that within your networks, because I guarantee you there's a senior there's someone who doesn't have a vehicle that we could keep healthy and safe by getting a vaccine if we simply took that transportation barrier down. And so we want to be sure to activate all of our community to help us with that. And Huntsville Hospital, a shout out to you. You've been wonderful at sharing that when you have your clinics. And we've got pictures of folks driving up and safely getting their vaccine and then on their way back to their lives. I will also take a moment to talk and remind the community that there are many needs that we are seeing as United Way and the nonprofit sector is addressing around the pandemic. It is certainly a public health issue. We will stand with the rest of the panelists here and say that's where it stands. It is an issue of keeping our communities safe and healthy. So we do also join these gentlemen and organizations in encouraging masking and getting your vaccine. The last thing I'll mention is that if you know folks that have been impacted by the pandemic, maybe they're in one of those industries that's lost a lot of jobs. Our hospitality industry has really suffered. Then know that there is a lifeline here in Madison County thanks to a partnership between United Way and Crisis Services of North Alabama. It is that 211 number. So 211 is not just the answer for transportation, but it's also the answer for most human needs. We're very grateful that in this community there are a lot of nonprofit services. There's not a perfect answer for every situation, but there are a lot of resources that the everyday citizen may not know about. And so always remember, if you're going to encounter people, and almost all of us do, we're not completely isolated, you're going to find someone either that walks up to you on the street or is a friend or a neighbor or someone that you interact with regularly, and they're going to bring an issue to your attention and ask for help, and you won't know where to send them. Now you know, always send them to 211. We are doing a citizen, what do we call it? A 211 ambassador program where everyday citizens can learn about 211, and we're doing that by Zoom now. Our next one is tomorrow morning at 8 o'clock. And so if you're interested in that, you can either call United Way at 256-536-0745 and get a link to the Zoom, or we do have it posted as an event on our Facebook page, again, UW Madison County. So the last thing I'll share is so amazing to me. I know that Huntsville Hospital has been seeing record numbers of all kinds of things as they've been one of the front leading health professional groups helping us deal with the pandemic here in Madison County. And I know that the city and the chamber and lots of folks have been involved in this. And getting the news out about 211 is happening because in 2019, for a 12-month period in that year, our call center in Madison County handled about 9,000 inquiries during that year. People calling, getting connected with resources, and then hopefully being able to find a solution to most, if not all, of their issues. When I look back at the last 365 days, that number is now 19,301 inquiries. And so that's coming from our fast growth that we had before the pandemic. It's coming by those increased needs of individuals that need help temporarily, don't know where to turn. And it's coming from our Ride United program, because that's the portal for getting to that, and also our work in partnership with 211 and the City of Huntsville to work to spend that CARES Act money around keeping people in their homes and avoiding eviction. So those are staggering numbers to us, but they illustrate the importance of that network. And so please do remember that. Join us for our ambassador training if you can. And remember that we really are better together. And that's always the message of United Way. When we collaborate as entities and organizations, as individuals, we build our capacity to respond to all kinds of situations, including the pandemic.
Thank you, Kathy, and thank you for watching today. Our next scheduled briefing is next Wednesday, October 6th at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. We do ask, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good afternoon, Dallas Parker with News 19. My questions are for Mr. Doty. You talked a little bit about percent positivity rates. A few weeks back, we saw highs in the 20s, and now we're down into the teens. Do you think this is a sign that we're, on going to the other side of the Delta variant craze that, spiked cases?
Yes, ma'am. The signs are pointing in the right direction. We're hopeful and wishful thinking that we're on the other side of the spike. 144 patients in the hospital now. With this current spike, we're at about 220 was our high number. So we've been coming down pretty steadily over the last couple weeks. We hope that continues and we get back to normal. So we're thinking and we're hoping it is in the right place. But I want to remind people the numbers are looking good because I think we're wearing masks and people are doing right by when they're out and about. So as a reminder, a good time to get your vaccine and always wear your mask when you're out and about doing things. Do things outside when you can, but when inside or around other people, wear your mask.
Gotcha. My follow-up question also for you. We talk a lot about characterizing people in the hospital who are unvaccinated. 90%, you said, of the cases are unvaccinated individuals. Can you characterize what it looks like when someone who is vaccinated is hospitalized with the virus? How long are they there? What are their conditions normally like? And if there's any underlying, issues, how does that work?
It depends on individual cases, but for the most part, we're seeing if you're vaccinated, you're less likely to come to the hospital. The numbers speak for itself. About 90% of the people in the hospital are unvaccinated people. Various reasons, good people. They have their own personal choices and ideas, not to belittle them or anything of that such nature. But what we're seeing with vaccinated people, when they do come to the hospital or they test positive, they're typically less symptoms. They're in the hospital, they don't go on the ventilator, or their illness is less, is what we typically see.
Thank you.
Hello, Stephante Randall with Channel 48. This question is also for Mr. Doty. Today, you guys kicked off the first vaccine clinic at John Hunt Park for the booster vaccine. Can you speak to how many people have already been registered and just kind of walk us through what, the requirements and what they need? And also, do you feel hopeful that with the booster being available, will you see a decline in cases as well?
Yes, ma'am. So the boosters for people who have gotten their first 2 doses of Pfizer, and we know that at the 6-month mark, studies show that your antibodies and your protection starts to wane. So the booster kind of gives your body another shock to increase your antibodies. So we're doing those at John Hunt Park. Over the next week, anywhere between 500 and 900 doses of first dose, second dose, and boosters are being done. So we have seen a spike in demand. Our website had more traffic, more calls. So people do want the booster shot, and we're there to give it to them.
Thank you.
At this point, we'll end the press conference. Thank you for coming.